Wakayela covers like 3 districts.
Yeah, it's quite big.
It's quite big. Well, like any other country, Rwanda has been hit hard by COVID-19. So our policy has been to act early and act really hard. Since the first case and when case spiked, we've imposed a lockdown. After the lockdown, we've started to manage through key measures normally promoted by World Health Organization, which is a trace, test, and isolate. We've been doing well so far. Numbers, we have 4,000 cases, confirmed cases. Half of them are still in the hospital and 50% have recovered of COVID-19. So it's pretty much good if you look at in comparison with other countries in the region. Whenever there's a spike and there's a specific spot, a specific cluster, so we've been imposing a localized, geographically lockdown. These things about COVID-19 involves measures, measures which require leadership and the way the people respond to leadership. Measures like social distancing, measures like lockdown. It's not enough to have leaders to put in place those measures, but it's also important how the people react and behave towards those measures. The Rwandan government has created a very special bond with the people of Rwanda. So the people of Rwanda trust the government. The second, as a country, we've used all the sorts of technology. Rwanda, after 1994, have made technology as a key pillar of development. There have been a lot of investment in STEM, in education, and we've created policies such as spurring innovations and so on. So some of these innovations and technology that the country has invested in have come back to actually help the country in this period. We've seen during this response to COVID-19 the use of, for example, robots to do some work in manage the rest of COVID-19 patient. And the robots are taking temperature, the robots are taking some of these vital signs to actually eliminate or even reduce the likelihood of medical personnel to be infected by things. So that's the thing we started. These technologies, which have helped through normal policy of innovation and technology, have come back to help us during this response to COVID-19. For example, the drones were used to spread the message, and a message on lockdown, message on social distancing, message on hygiene and safety in areas where it would be difficult for people to get to. So these are examples of the technology, of the results of technology and innovation which the government has invested in, which has helped a lot on COVID-19. All along, Rwanda has been building a healthcare system in the country. More than 80% are insured in the country. There's a universal healthcare system, access to all Rwandans. We're trying to have what we call the health post in each and every cell, centralize them, and educating medical doctors and using the investment to have also other equipments and so on. So all these measures which have been made by the government throughout all these years have come back also to help the country. The whole system then has learned in Rwanda to listen to new ideas and challenge and disrupt all the time when there's something coming up. So it didn't take much to find out that actually we can use some of the technology in the response to the pandemic. I could give you examples. The use of drones. I think actually the drones started to be used almost 2 weeks after the lockdown was imposed, because quickly the team find out that to be able to spread the message, to be able to monitor what is being done, we can use some of the things we have, which is drone, because it has already done some other work in the healthcare system. In a country which is developing and which is putting all its efforts in investment on development projects to lift people out of poverty. And then you take some of those resources and you divert them and you put them into the response to COVID-19, it kind of disrupts the whole system economic progress we're having. But also, though we've invested a lot in human capital and human resources and in equipping the healthcare system and as well as other systems with the human capital, much is still needed. We spend much time on what we have and how we can efficiently manage any problem. In 2019, the GDP was a double digit. It was 10% approved by IMF and then 12% in some of the quarters. And now the GDP growth is predicted to be 2%. So the outlook actually this year was that it was going to continue to be in the same, on the same path of double-digit growth. It has taken us a lot. We will maybe discuss it in some specific sector, but generally it has taken us a lot. But we don't say that it's impossible to recover. We can recover. Rwanda has gone through even more worse than that. And the spirit of the people of Rwanda and the spirit of the leaders of Rwanda is that we can recover on anything. There's a plan, there's a recovery plan, providing low interest loans to different sectors. So Rwanda has created a fund, COVID-19 recovery fund, which will provide these low interest loans to specific sectors and companies and private traders and all these type of people who've been hard hit by COVID-19. So the fund is there, the finances have been secured, and it has started to work and has started to support these different sectors.